Coming up on Primary Care, part 2 of the history of black health in Detroit.
The people need care. You're denying black physicians, you're denying young students who want to be doctors, you're denying patients basic health care.
Hello, and welcome to Primary Care, where each week we focus on topics related to the health and care of African Americans. I'm Dr. Lonnie Joe. Today's show is part 2 of our discussion on the history of black health in Detroit with Dr. Richard Smith. Dr. Smith is Vice President of Physician Outreach at the Henry Ford Health System. He is the first African American to serve as president of the Michigan State Medical Society and is a past president of the Wayne County Medical Society of Southeastern Michigan. He is also a practicing obstetrician gynecologist who's delivered over 9,000 babies in Detroit, and he's Primary Care's honorary historian. And this discussion on the history of black health here in Detroit, Rick, this is just phenomenal. It is history that should be not just explored. This is history that needs to be broadcast. And I want to thank you again for coming on the show and not only reminding us, but educating us about what actually happened and how A led to B, led to C, and how we got to where we are today. In our last show, we left off talking about the development of the Detroit Medical Center as we see it today, and some of the issues behind that, such as the public dollar that actually was the impetus to do that. You want to pick up on that for us?
Well, the Detroit Medical Center today is not what it was in the 1960s. There were hospitals which were geographically located, but they had a plan to get federal dollars to expand and do things. But the Detroit Medical Center had a problem because the African American physicians wouldn't agree with us. That's what a plan, because they didn't have staff privileges. There were no staff privileges for physicians there until after that, until they said this is not going to happen. An organization by what's called the Detroit Medical Society, which is an organization of physicians, changed that, and that's why the dollars were released to go there.
As you probably know, Dr. Lonnie Swing at the time was president of the Detroit Medical Society and went on to become president of the National Medical Association, who kind of led this discussion with the federal government. As president of the National Medical Association, he actually petitioned Lyndon Johnson for time to talk about the Detroit Medical Center and the lack of African Americans on staff.
I think he did more than that. He actually sat out and met with the president at that time and outlined the plan. The National Medical Association supported Medicare.
Absolutely.
Again, yeah. The AMA did not. Right. The National Medical Association, as well as members of the AMA, protested the AMA because of their stance on denying care to Americans. Right. But also the fact that they did not accept African Americans in the South into the AMA. It was the way the organization was set up is that in order to be a part of the AMA, you had to be a part of the local medical society. If you weren't part of the local medical society, you couldn't even get staff privileges in any of the hospital. Oh, you just, because you're not, and it was just a wink of the eye, and it kept African Americans out. Now, Lonnie Swing changed that. Howard University grad, also very aggressive at getting things done here and changing things not only in Detroit, but in America. Another person I wanted to break out is a fellow named Yancey, Asa Yancey.
Yes.
Asa Yancey was a graduate of the University of Michigan. There have been 3 graduates from the University of Michigan. Yancey's from Michigan. His older brother was there, but he died going to his residency training by a new machine called the X-ray machine. He got electrocuted. Asa Yancey graduated from Michigan, fell in love with a young lady from Detroit, like a lot of us have, from Detroit, and got married right there, the church, Plymouth Church, right across from the Arbor Hospital. Right. Couldn't practice it, couldn't get an internship though. So they turned him down, and after accepting him. So he left, and he has set the world on fire. He went to Howard, like many people did from Michigan, and went on and developed a surgical residency program. The rest is history. He's trained scores of African American surgeons. The medical center in Atlanta is named in his honor, and he's a member of the National Institute of Medicine, which is like getting a Nobel Prize, but he couldn't practice in the Detroit hospitals.
Where his roots were.
So things have changed things, but things did change. and changed by the efforts of so many people. They changed at Wayne State with Charles Whitten and with Dr. Vincent and the admissions committee, and said we need to change from a point where you only had a student every couple years to one where you became, behind Howard and Meharry, as a number of African American students. And it existed like that through the 70s into the 90s as well because of their leadership. And they changed things and helped change the face of America.
That leadership, to backtrack a little bit, was the reason that Lyndon Johnson, who gave Dr. Lionel Swan, president of the National Medical Association, the National Black Doctors Organization, 5 minutes on his calendar to meet with him. Mm-hmm. And Dr. Swan, as he told the story, got right to the point. Said, Mr. President, I only have 5 minutes, but I'm here to talk to you about a medical center that your funding is building in Detroit, and they won't allow black physicians on staff there, and you need to do something about it. 45 minutes later, after a 5-minute appointment, Dr. Swan left with an agreement, and I think it took what? How many days?
Less than a week. They had 6 people appointed.
Less than a week they had.
They were knocking on people's doors to come in there.
And some of those names?
Oh, those names, you could look at them. Dr. Lackey was down there. Yes. We mentioned about that. Right. You had residencies coming in. Dr. Vincent Combs were denied residencies. They were brought in as residents, and it goes on and on. It's just because it was the right thing to do. It was simply the right thing to do. And that's just it. These physicians are mission driven. They're here for the care. The people need care. You're denying black physicians. You're denying young students who want to be doctors. You're denying patients basic health care. And that changed in that moment, in that instance, by the people of Detroit. It's one of the best things that we did in medicine. Now, our state of Michigan has done a lot of wonderful things in medicine. This is where the first EKG machine came from our state of Michigan. The penicillin trials were done at Henry Ford down there. The polio vaccine was changed how people care.
Right here at Wayne
was
State.
Down here at University of Michigan in the laboratory,
right
near Rackham there. I mean, those are some of the things. Today we see great things happening now. Precision medicine is taking place here in Michigan. We see the robotics, everybody does robotic, minimally invasive. That started right over at Henry Ford. Those sort of things. The first in vitro fertilization down at Hutzel Hospital. So all these are great things that come out. So we can do great things if we let all that baggage go and go forward what we have to do.
Here again, little known history that certainly needs to be celebrated properly in the proper places, certainly at the proper times. But how are we going to keep this ball up in the air, Rick? I mean, this is important stuff. If we don't learn from it, we're gonna lose the benefit of it. How do we keep this ball up in the air?
Well, there's one important thing that happened too recently, and this happened in 2004. We've talked about the struggles of African American physicians against privileges with the AMA and all that. Well, there was a dinner that was co-hosted by the Detroit Medical Society, Organization of Black Physicians, as well as the Michigan State Medical Society down in Detroit. Over 200 physicians were involved there. This first meeting of its kind. And we invited the president of the AMA there. And he gave his usual sort of speak about all the great things the AMA is doing and everything else. There was one doctor in the audience that raised the question to him, why has the AMA been so prejudiced against black doctors? And then from that question alone, there was people lined up to the microphone and began to tell their stories of how they were abused, how some were arrested for taking care of their patients, how they were denied privileges, all the denials that took place there. It became an emotional moment for many of the physicians, as well as the president of the AMA, Dr. Nelson. At that point, sobbing, he said, on behalf of the AMA, I apologize for our treatment of African American physicians.
I was in the room, I remember it well. We're gonna move to another break. We'll be right back with more primary care and Dr. Richard Smith.
All across the country, people are coming together to speed up what we can learn about health. The All of Us Research Program is calling on 1 million people to join us as we try to change the future of health. For your family, for future generations, for all of us. Visit joinallofus.org and find out how you can become 1 in a million.
As we stay home to do our part flattening the curve, it's important that we remember our personal mental well-being as well. Each day, create a schedule for yourself so your mind stays sharp and active. Be sure to set aside time to stretch, meditate, or exercise. And stay connected to others in new ways or old. It's little things like these that will keep us all strong and in the fight together. For the latest updates on COVID-19, visit uofmhealth.org.
Hi, I'm Loretta Bush, President and CEO for Authority Health. Testing still remains an important tool in our fight against coronavirus. While many people may have symptoms such as cough, fever, or shortness of breath, some will have only mild symptoms or no symptoms, but still be able to transmit. There are many opportunities to test in our community, including at our Popoff Family Health Center. Call 313-824-1000.
Welcome back. We're here with Dr. Richard Smith, continuing our discussion on the history of black health here in Detroit. Rick, continue where you left off, because that was a powerful meeting that night.
It was a turning point in America at that meeting that took place right here in the city of Detroit. Dr. Nelson said he was totally unaware. He had practiced in Utah, was not aware of all these things, and it's really what the struggle people have to get care to their to the citizens. So from that point on, he vowed to take this apology to the AMA. They set up a commission within the AMA, let's look and get the details, and they researched it. And the new generation of doctors says this was wrong. And they made a public statement here. They published the entire journal of the Journal of American Medical Association, as well as a press conference on CNN and around the country, and formally apologized to the maltreatment of African American physicians in the history of medicine in America. And the rest took on life on its own. So that was a very important moment that took place here in our city. A second moment that took place was a fellow named Gail Worden. Gail Worden was an idealist, a thinker. The school at the University of Michigan, Public Health, is named in his honor. Well, he was the CEO at the time. He came to Detroit and said, we need to do something about urban health care. And the first things he did was set up an Urban Healthcare Institute and invited all the young minds around the country to participate with their ideas, and began to shift the focus on just healthcare and antibiotics and everything else, but to the actual care of populations and the care of people. And that set up a whole new thing about the disparities in healthcare, and something needs to be done about that. That was another sentinel moment that occurred in our area. We have more young men and women going to medical school now at Wayne and at Michigan, although Michigan's numbers fell due to some of the legal situations that took place at that time. But yet the promise of young people continued because of that. And we do see more people wanting to go to medical school, but still finding some barriers in their place. They tend to be better physicians to the African American community on that, because they have an insight to that, and that's why it is important. And they all are exceptionally bright people being denied for reasons we still don't know.
More modern times. Yes. You very astute in the recognition of, what has changed and what has happened. What do we need to do to continue this? I mean, there's still a lot of work to be done. We've got some unfinished business in healthcare as it relates to African American physicians. Okay, what do we need to be doing now, leading towards the future, to get back to some of the stature that we had just in terms of numbers, like production of and education and training of physicians at a phenomenal place like Wayne State, who at one time led the country in putting up numbers outside of Howard and Meharry.
Well, you mentioned Wayne had a stumbling block by a couple of people who felt that it was their job just to restrict the number of African Americans in school. Their numbers dropped to one year. You went from an all-time high to one medical African American student in their class. We can't go back to those times, but those issues still exist. We have to be vigilant about that and understand that we need to educate these young men and women. The young men and women, they have to do more than just, I took a STEM class. They have to want to be physicians. It is still a calling for that sort of thing. And it's just still our mission driven to take care of the people that we have here. And so I would tell young people the road to medical school is a hard one, but you can do it. People have done it with worse circumstances.
Absolutely.
And they can still do that, and they should do that, because I'm getting old. You're younger than me, but I'm getting old.
So you think?
So we need to encourage young people to go into the sciences and that sort of thing. We have great engineers out there as well, and to work with these, doing some of the biotech in medicine. There's other things that you can do to help people in that, but that's what we do as physicians here. And today we have some outstanding examples of that. We look around at the marvelous people we have in this Detroit community here. You know, I think, for example, Dr. Celeste Williams, cardiologist.
Heart failure expert.
A heart failure expert. There's only 2 places in the country, in the state of Michigan, get a heart transplant. She's in charge of that. You have to see her, African-American woman from Iowa, but she's an African-American woman. She leads heart transplants. I mean, who does that sort of thing? That's how brilliant people we have right here. We hear about the bariatric surgery. Michael Woods doing wonderful surgery in order to do that. The chief of staff at Sinai Hospital is a surgeon. Dr. Barnwell's doing that thing. But again, if you will need a multi-organ transplant, there's only 5 places in the country you can get that one. Jason Denny. Jason Denny is the guy who can transplant every organ in the body. An African-American physician here.
Right here in Detroit.
There's one person I want to talk about, and that is Dr. Emmanuel Rivers. There are 10,000 doctors in Southeast Michigan. Only one doctor has ever been invited to join the Institute of Medicine, and it's Dr. Emmanuel Rivers. The Institute of Medicine is, again, like the Nobel Prize. An African-American person from Southwest Detroit, University of Michigan graduate, came down there and he developed a technique called early directed treatment and care for patients who have pneumonia. And it changed the world, saved thousands of lives. When students walked around with their white coats on, they asked them, what are the Rivers principles? This is the sort of intellect that you have and the performance that you have among African Americans today.
All of it right here in the city.
Right here in the city.
And more. I know we don't have time to mention them all, but I know you know them all. That is a collective body of work. That is a collective body of knowledge, even though they might be associated with various institutions around. But here again, if we can have children identifying who the players are on the baseball and the football teams, we should be able to identify some of these people who are saving lives, who are making a difference in the healthcare of a community, who are actually dedicating their heart and souls to what they do. We just have not celebrated this properly.
And sometimes we take it for granted. Not only are we physicians, we have leaders now who are doing remarkable things. We have Dr. Wilson, who's over at Wayne State University, changing the way the Wayne State University is being operated on, looking at quality as being presented. This is a physician who's running things now that we should fully support, an excellence of a physician there. At Henry Ford, Wright Lassiter runs one of the largest healthcare systems in the country. Exactly. At Henry Ford. Power broker, have it right here. Now, another person I would say, not here in Detroit, but down in Ann Arbor again, one of the Regents up there has made it so that you can go to Michigan for free.
Just qualify.
Just qualify, and you can go for free there. And Shauna Diggs, a Regent at the University of Michigan, a physician as well. We go down to the Morehouse School of Medicine. Valerie Montgomery Rice, one of my former partners, is one of the most powerful women in health.
You were partners with Valerie?
Yes.
I did not know that.
One of the most powerful women in healthcare
Absolutely.
in the country here. Valerie,
now
Harvard grad,
Dean.
Harvard grad, came
Yes.
to Michigan, came to the Hutzel and then over to Henry Ford before going in and just turning the world on fire.
Rick, we're going to take another break, but we're going to come right back with more of Dr. Richard Smith, Vice President of Physician Outreach at Henry Ford Hospital.
All across the country, people are coming together to speed up what we can learn about health. The All of Us Research Program is calling on 1 million people to join us as we try to change the future of health. For your family, for future generations, for all of us. Visit joinallofus.org and find out how you can become 1 in a million.
Here are your AARP top tips on caregiver preparedness during coronavirus. First, form a caregiving team. Create a list of people in your family and friend network who can help with caregiving tasks. Take an inventory of supplies in your loved one's home. Try to have a 2-week supply of essential items. Make a list of the care recipient's medications and medical contacts. Be sure to have prescriptions on hand and ask the pharmacist for an extra 30-day supply. Make a plan to stay connected. To prevent social isolation, set up available technology to help loved ones stay connected and schedule regular chats. Finally, maintain your own self-care. Follow the Centers for Disease Control's guidelines for coronavirus safety. And have a backup plan for care in case you become ill. For more caregiving tips during the coronavirus pandemic, go to aarp.org/caregiving.
As we stay home to do our part flattening the curve, it's important that we remember our personal mental well-being as well. Each day, create a schedule for yourself so your mind stays sharp and active. Be sure to set aside time to stretch, meditate, or exercise. And stay connected to others in new ways or old. It's little things like these that will keep us all strong and in the fight together. For the latest updates on COVID-19, visit uofmhealth.org.
Welcome back. We're here with Dr. Richard Smith, our honorary historian and Vice President of Physician Outreach at Henry Ford Hospital. Rick, we left off talking about a lot of things, so let's just turn this car back on and hit the road with it again.
Well, I think there's a lot of positive things that have come out of this. I mentioned some of the doctors that are truly all-stars. One of the ones that I forgot was Dr. Lisa Newman, who's changed the way we think about breast cancer in women. And it's so fortunate to have more women in medicine now because they add a different flavor to what we're trying to do. Dr. Lisa, with her team, which includes Dr. Erica Proctor at Henry Ford, they would travel back and forth to Ghana and found the genetic link between triple-negative breast cancer that affects African-American women in this country. She's known throughout the world for her work, and it's right here in our own backyard. So, I mean, if you follow up Lisa Newman, Dr. Proctor, and the work that they're doing for women who have breast cancer and a comprehensive approach to that sort of thing, that's in our own midst. This is a value that African-American physicians can enlighten the world upon. There's also the political side of this. I want to talk about Dr. Ted Jones. Dr. Ted Jones, working with Nancy Schlichting and others, took on the task of bringing the Affordable Care Act to Michigan. The Affordable Care Act was a game changer for citizens here. We've been able to reduce infant mortality, increase hospital visits, provide care to people, and do all these things by the energy and the foresight and the effort by these individuals to bring care to people. It doesn't matter if you're black or white or whatever, you can get care now. It helps community, it's create jobs, it's the way we need to go in the future to involve more people in it. And the young people need to take a look. I can be a physician, I can be a surgeon, I can be like Dr. Newman. I can be like Etheline Crockett. I can be like Marjorie Myers. I can do that sort of things. We can change the world with their insight.
Rick, all of these people who, we've known for years, all of these people, though, brought something to the table more than just being a good doctor. They brought a spirit. They brought some commitment. They brought a compassion that, actually enhanced everything that they did. They stepped outside of the role of being a physician a lot of times to say, hey, this is what we need to do. Every person you've mentioned, I can point to in a direction that said, Lisa did this, Marjorie did that. I mean, it was something to say, oh, I'm not just practicing medicine, I'm gonna make a difference, okay? Because only 20%, 30% of the time, we know that we're really affecting change in patient care. The other stuff are all the social and socioeconomic and the other determinants of healthcare that these people actually embraced so that they could do a better job as physicians.
That's the message that you learned at Howard University.
Absolutely.
You're at Howard there because the people need you. It's a mission-driven institution. Thank goodness that there is a Howard University. Thanks goodness that I had a chance to go to learn under those great professors that had it there. The philosophy there, they wanted to guarantee your success because if you didn't make it, that's one less African-American physician in the world. And we need that because the numbers are so small.
And you failed to mention, I know there are lots of them, but the giant in transplant surgery, LaSalle Lafall, who we lost.
Oh, Dr. LaSalle Lafall, I get chills when I think about him right now. He's just a fantastic person, spoke several languages. When he gave his papers across the world, he was speaking their own languages, totally committed to the patient care and the philosophy of each patient first. And also the calmness that comes with being a physician, that equanimity under duress that you must have to be a qualified physician, a bedside physician, and a consummate surgeon, just fantastic. This is a great profession. If a young person is thinking about something that they can do, that they can truly help someone, not just put it on words, I want to help somebody, but actually get in it, do that. A day doesn't go by when somebody from the city of Detroit comes up to me and thanks me for their contribution and caring for their parents. I did a lot of half of them, you know, that sort of thing. But I've enjoyed the practice of medicine. I've been inspired by the people that I have worked with. I see the hard work that they do, the hard work in order to get to that point, and I don't take it I don't take it lightly at all. I'm again, as I said at the onset, I'm thankful for that you have provided me that trust.
This has been an exciting discussion. You know, we could do hours of this on end without even taking a break. But Rick, thank you so much for joining us on the show. Let me personally thank you for all that you've meant to this community, professionally and otherwise. You're one of the people that just said, listen, there are other things to be done besides practicing medicine, and you've stepped outside of that role, brought your expertise with you to these things, and actually helped other people understand where we need to go, what direction that healthcare needs to take place in this community. So we're very proud to have you here. It's been an honor. And thank you so much for joining us on Primary Care.
Thank you very much.
Thank you. Good. Our guest has been Dr. Richard Smith, Vice President of Physician Outreach at Henry Ford Hospital, the first African-American president of the Michigan State Medical Society, and a past president of the Wayne County Medical Society of Southeastern Michigan, as well as the Detroit Medical Society and National Medical Association. I hope that you've learned a lot from today's show and were inspired by what you heard, because I surely was. It's been a real education for me. Until next time, for Primary Care, I'm Dr. Lonnie Joe.